Last night, I received the copy of a circular which is dated 12th August 2026, issued by the State Project Director of Goa Samagra Shiksha of the Government of Goa. And this circular is having a title subject, Creation and Validation of ABBA IDs. It says that the Ministry of Health and Family Welfare has rolled out RBSK 2.0 portal to strengthen digital health records of children through a unique health identifier and health cards. And it is in this connection that this circular has been issued to obtain certain data of the children in the school. The data which is sought from the schools is particularly the details of the children, and more particularly is about the height, the weight and the hemoglobin. Now this circular is dated 12th of August, sent to the schools on 13th, and now today is 14th, tomorrow is 15th, and 15 August, which is Independence Day. So everybody will be busy with functions, and I'm sure that many of these clinics, laboratory testing places, pathologists and all will be off. Sunday is again a holiday, and they expect this to be submitted by Monday. I went through this RBSK and I wanted to know what it was, and I found out that it was a very good move by the central government to identify deficiencies of children, which is from birth to 18 years, from defects at birth, deficiencies, diseases, development delays, including disability. Now, when this is there, this circular speaks about manner in which children are to be screened at home from birth, and once they get into school, how it is to be done at Anganwadis, and also screening at schools and government aided schools. And this circular speaks about a team. This is important. The mobile health team will consist of 4 members, 2 doctors, Ayush, 1 male and 1 female with at least a bachelor degree from an approved institution, 1 A&M stroke staff nurse and 1 pharmacist with proficiency in computer for data management. So why is this that the government is seeking to provide a mobile a mobile team to go to the schools? Is because they want to verify independently from their records, from their verification, and authentication from their labs about the condition of each child. Therefore, they are not allowing under this scheme private pathological labs or private institutions to submit the reports and submit it online. From this, what I have understood. Therefore, my question is, how is this to be implemented? This circular, which is issued on 12th August 2026, to be implemented without the mobile team and in such haste, and to submit the hemoglobin report by Monday. Who will pay for this expense? Will the children be given leave from school to start going and queuing up before pathological labs, and will they be accepted to be submitted? On what basis will this data be entered, uploaded by the schools without the mobile clinic, the mobile team being available in the school? This scheme I saw was launched, 2.0 was launched in May 2026. Why was the government of Goa and this Goa Samagra Shiksha sleeping over this? This is part of the education department. So why was the education department also not aware or sleeping over this project? They could have started it. By now you would have had much of the data collected. Is it that the central government is asking you for updating your record and submitting of some data and uploading and taking stock of what work has been done, and in that speed you now want to claim that you have done everything? This is a complete fraud. This very manner in which this data is sought to be asked to be collected and uploaded is contrary to the very scheme of the central government. This circular needs to be withdrawn, and I demand that the government of Goa should withdraw this circular, provide these medical teams at each school, collect the data properly, because definitely I am in support of this kind of a mission, because we need to identify children, know their defects, know the problems. Sometimes if a child is having a grave communicable disease, then it can affect other children, so everyone can be safe. And if there is something which can be curable as the child is growing up, this can be attended, or deficiencies can be anticipated before they become in an aggravated state. So I think that the government of Goa needs immediately to relook at this and direct withdrawal of this circular dated 12th August 2026, and not make a mockery and force the institutions and the children to start undergoing this test.
तुम्ही पळयतात गोंयकारपण, गोंयकारांचो गोंयकारा खातीर.